All right, so I'm going to go over how the Trump administration did not address the coronavirus outbreak in an efficient manner to meet national security concerns. I'm definitely going to go over the 5 minute mark. This hits home for me. I lost my grandfather to the virus, so this is a way of me letting out some frustration. So I appreciate the opportunity to do so, and also appreciate the understanding ahead of time. So we're going to go through a timeline of all the warnings, how they were ignored, how the president failed to respond to the needs of the country, and also how his messaging was just piss poor, to put it politely, and also how we handled it and how it affected us and made us vulnerable in regards to national security. So we'll start it back with 2005. President George Bush delivered a speech about how the pandemic posed a very serious threat to us, and as a country as well as the world. 2007, Bush era CDC publishes a pandemic response plan. So even in 2007, there was a plan. And in 2011, there's another study that said in a severe influenza pandemic, hospitals will likely experience serious and widespread shortages of ventilators, which we all know are critical. 2015, CDC released a study warning of a deficit of up to 60,500 ventilators in a severe influenza pandemic. This is also when the strategy of flattening the curve came into existence. In 2016, after the relatively poor handling of the Ebola outbreak, the Obama administration prepares a 69-page pandemic playbook to coordinate an early response and a government response for all the future administrations should a pandemic occur, which we all know Trump did not use. January 2017, outgoing Obama officials conducted a disaster response exercise described as the worst influenza pandemic since 1918, the Spanish flu. They did this with the incoming Trump officials. From January to August of 2019, the Trump administration runs a pandemic war game called Crimson Contagion. It modeled an outbreak of an uncontrolled flu pandemic originating in China. In late August, a contract dispute left the federal stockpile of ventilators without maintenance. So when this equipment was later distributed, many of them were broken. In October, the confidential Health and Human Services Department report on the Crimson Contagion documents our failure. It stated, currently there are insufficient funding sources sources designated for the federal government to use in response to a severe influenza pandemic. It warned the U.S. lacks domestic manufacturing capacity for the production of sufficient quantities of personal protective equipment, and that domestic supplies of on-hand stock of N95 respirators, ventilators, and other ancillary medical supplies are limited and difficult to restock because they are often manufactured overseas, making us rely on foreign countries or foreign companies in foreign countries, vulnerable for national security. November was the first intelligence report of a contagion ripping through the Wuhan area in China. It was reported by the U.S. military's National Center for Medical Intelligence. January 18th, Health and Human Services Secretary Azar, who had been alerted about the outbreak in the beginning of January, finally reaches Trump to talk about the coronavirus, but the president chooses to talk about the political fallout from the administration's flavored vape ban. January 29th, a memo from Trade Advisor Pete Navarro to the National Security Council warns America would be defenseless in the case of a full-blown coronavirus outbreak on U.S. soil, a full-blown pandemic imperiling the lives of millions of Americans. January 30th, World Health Organization declares an health emergency. Azar reportedly called Trump to warn him of possible pandemic. Trump downplays the threat, responding that Azar was being alarmist. January 31st, Dr. Anthony Fauci warns of asymptomatic spread. He is quoted saying, in the beginning, it was not clear whether an asymptomatic person could transmit it to someone while they were asymptomatic. Now we know that is absolutely the case. February 3rd, U.S. Army estimates the coronavirus could kill as many as 150,000 Americans in a worst-case scenario. February 5th, Azar asks Office of Management and Budget for $2 billion to replenish national stockpile with respirator masks and other supplies. White House cuts the request to $500 million. At the same time, senators were briefed by the administration on the coronavirus, and they left discouraged. Senator Chris Murphy from Connecticut tweeted, "Just left the administration briefing on coronavirus. Bottom line, they aren't taking this seriously enough. Notably, no request for any emergency funding, which is a big mistake. Local health system need supplies, training, screening staff, etc., and they need it now." February 10th, Trump downplays the threat to the U.S. He is quoted saying, "The virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in." His exact words. The Trump White House at the same time unveiled a 2021 budget request, which included a $85 million cut for the CDC's Emerging and Zoonotic Infectious Disease Program and a $25 million cut for its public health preparedness and response. February 14th, a second memo from a National Security Council memo said U.S. government response to the 2019 novel coronavirus reportedly outlines a potential federal social distancing response. The memo also contemplates school closures and widespread stay-at-home directives from public and private organizations, with nearly 100% telework for some. February 21st, coronavirus reportedly reviews a proposal by Dr. Robert Kadlec. He's a top health and human services doctor who had overseen the Crimson Contagion exercise for social distancing to lockdown of the U.S. economy. It was attended by Redfield, Azar, and Fauci. The group, quoted, concluded they would soon need to move forward aggressive social distancing, even at the risk of severe disruption to the nation's economy. Messonnier of the CDC on testing says testing is adequate and says there's no lag time for testing at this point. February 23rd, Peter Navarro sends a second memo to the National Security Council, increasing probability of a full-blown COVID-19 pandemic that could infect as many as 100 million Americans with a loss of life as many as 1.2 million souls. February 24th, Trump insists virus is under control. He tweets, "The coronavirus is very much under control in the USA. We are in contact with everyone in all relevant countries. CDC and World Health have been working hard and very smart. Stock market's starting to look very good to me." Trump also seeks $1.25 billion in coronavirus response funding. February 24th, the Association of Public Health Laboratories warns the FDA that the U.S. is now many weeks into the response with still no diagnostic or surveillance test available outside of CDC for the vast majority of our member laboratories. Coronavirus Task Force reportedly agrees to present Trump with a social distancing mitigation strategy. Trump delays and travels to India. February 25th, CDC's Messonnier releases a statement saying, "We expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more of a question of exactly when this will happen and how many people in this country will have severe illness." He warns of school closures, missed work, and loss of income, and that disruption to everyday life may be severe. Following this, on February 26th, Trump calls Azar, and he's enraged about the Messonnier statement, saying he unnecessarily scared the markets. There are plans to brief Trump on the need for social distancing measures, but they were scrapped. More than 2 weeks will be lost before federal government recommends distancing measures. At the same time, Trump downplays the seriousness of COVID-19. He is quoted saying, "This is a flu. This is like a flu. We have a total of 15 people, and they're in process of recovering. In a couple of days, we're going to be down close to zero. We're going down, not up. We're going substantially down." Unfortunately, he was right. President defends cuts to public health bureaucracy. He is quoted saying, "Some of the people we cut, they haven't been used in many, many years. And if we have a need, we can get them very quickly. And rather than spending the money," and I'm a business person, I don't like having thousands of people around when you don't need them. When we need them, we can get them back very quickly. Right. February 27th, Republican Senator Richard Burr, who got in trouble for dumping stocks after a briefing tells a private audience in Washington that he's quoted saying, "There's one thing that I can tell you about this. It's much more aggressive in its transmission than anything we've seen in recent history. It is probably more akin to the 1918 pandemic." Trump, on the same day, it's going to disappear. One day it's like a miracle. It would disappear. February 28th, to show maybe why their response was terrible, White House Chief of Staff Mulvaney tells attendees of CPAC, the conservative conference, where the coronavirus was spreading, he is quoted saying, "The reason you're seeing so much attention to it today is that they think this is what's going to bring down the president. That's what this is all about." Mulvaney insists the U.S. is on top of outbreak. He is quoted saying, "This is something we know how to deal with. We are the best in the country. We are the best country in the world prepared to do this. We have been preparing for this for years. We know how to handle this. We're ahead of the curve already." Trump on the same day, "We've done a great job. The press won't give us credit for it." Trump is at a rally later and is quoted saying that this coronavirus, and I quote, "This is their new hoax." All right, so February 29th, first death. March 4th, death toll at 11. Trump goes on Hannity saying, "We have hundreds of thousands of people who get better just by sitting around, even going to work. Some of them go to work, but they get better." And in regards to the death rate, he says, "I think 3.4% number is really a false number. Now, this is just my hunch, but based on a lot of conversations, personally, I'd say the number is way under 1%. This is critical because his messaging is people follow what he says. If he said, people live by his word. He's the president of the United States, leader of the free world, unfortunately. At the same day, Pence makes a claim of testing availability. He says, "We'll have over 1 million tests in the field today." For the record, 1 million tests would not be completed until the end of the month. March 5th, that's all at 12. Trump, in regards to him saying people can go to work and they'll get better, his tweet is, "I never said people that are feeling sick should go to work. This is just more fake news and disinformation put up by the Democrats, in particular MSNBC. Comcast covers coronavirus situation horribly, only looking to do harm to the incredible and successful effort being made." Fauci on the closure of the pandemic response team in the White House. He is quoted saying, "We worked very well with that office. It would be nice if that office were still there." This is when Congress passed the first passed $8.3 billion coronavirus spending package. March 6th, Trump visits the CDC in Atlanta and blatantly lies. His quote is, "As of right now, anybody who needs a test can get one, and the tests are all perfect, like the letter was perfect." Trump admits that he wants to keep infection numbers low, so he advises against unloading a cruise ship with sick passengers off the coast of California. He's quoted saying, "I like the numbers being where they are. I don't need to have numbers double because of one ship. That wasn't our fault." And Trump praises his own understanding of science by saying, "I really get it. People here are surprised that I understand it. Maybe I have a natural ability." I think people were surprised that you can understand anything. Anyway, March 8th, death toll 22. So South Korea and the U.S. had their first case on the same day. At this point on March 8th, South Korea has tested 189,236 people. The United States has only tested 1,707. March 9th, death toll 26. Trump tweets, "So last year, 37,000 Americans died from the common flu. It averages between 27,000 and 70,000 per year. Nothing is shut down. The life and the economy go on. At this moment, there are 546 cases of coronavirus, with 22 deaths. Think about that. People will follow that. So the national security risk to that is that it'll make the matter worse because people aren't taking this seriously. When that happens, it affects the hospitals and it just makes the numbers go up way more. Critical to our national security." March 10th, death toll 30. Redfield, after part of the coronavirus task force, after saying that testing was good, everything was perfect. He testifies to Congress and is quoted, "The truth is we've underinvested in public health labs." March 11th, death toll 38. World Health Organization declares a global pandemic. In primetime address, Trump announces a travel shutdown between U.S. and Europe. Misspeaks while reading the teleprompter, suggesting cargo and trade are also affected. The markets tank. National security, like that just something like that, something that seems so small, has such a big effect and affects the ripples, and who knows how big of an effect it has. March 12th, death toll 41. Health and Human Services makes a modest $4.8 million order of N95 masks from 3M. It's the first purchase to protect frontline workers on March 12th. Dr. Anthony Fauci testifies to Congress about testing. He says the system is not really geared to what we need right now. That is a failing. It is a failing. Let's admit it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes. But we are not. March 31st, death toll 48. Trump declares a national emergency. In a Rose Garden ceremony with executives from drug companies, Target, Walgreens, Walmart, Trump makes empty promises. Google will launch nationwide website to direct Americans to widely available drive-through testing. Never happens. When he's asked about Dr. Anthony Fauci's comments about the failure remark on testing and whether the buck stops with the president, Trump says, "I don't take responsibility at all." March 16th, death toll 95. When asked to evaluate his response in a 10-point scale, Trump says, "I'd rate it a 10. This is when Trump starts calling the coronavirus the Chinese virus. Relations with China are already, with the trade war and everything, are already not where it's good for us. This puts added pressure on international relations for unnecessary reasons. Completely unnecessary. Imperial College UK study warns 2.2 million U.S. citizens could die with an uncontrolled outbreak. The White House finally recommends against gatherings of more than 10 people, encourages work and school from home. Trump says we'd much rather be ahead of the curve than behind it, and that's where we are. White House launches the 15 days to slow the spread. March 17th, death toll 121. Trump is quoted saying, "I've always known this is a real pandemic." The testing lags persist. South Korea at this point has 274,000 tests done. The U.S. only has 25,000. In order to get things under control, you need to know where it is to stop it there and put it out. Or else you're fighting blind. You're not doing anything. March 18th, death toll 171. Trump is quoted saying, "It snuck up on us," referring to himself as a wartime president. March 21st, death toll 374. Health and Human Services finally makes a large investment in protective equipment with a $173 million order for N95 masks. Death toll 509. March 22nd, death toll 509. Trump starts railing about the cost of social distancing. He says it's all in caps, well, I don't know. He says, "We cannot let the cure be worse than the problem itself. At the end of the day, at the end of the 15-day period, we'll make a decision as to which way we want to go." March 24th, death toll 957. Trump once again is raging about the shutdown. Tweets, "Our people want to return to work. They will practice social distancing and all else. And seniors will be watched over protectively and lovingly. We can do two things together. The cure cannot be worse, in parentheses, by far, than the problem. Congress must act now. We will come back strong." His messaging, it just makes the situation so much worse because people will follow them. There was the protest. There was that all puts a strain on the country, an unnecessary strain that takes valuable resources from where they need to be. Trump then on March 24th says he wants to open the country by Easter. He reveals that he set the target independent of any health advice. When asked why he set that date, he is quoted saying, "I just thought it was a beautiful time. It would be a beautiful time. A beautiful time. It's a great day." His words, literally his words. Dr. Fauci admits the U.S. is still held back by lack of testing. He is quoted saying, "Particularly those areas that are not hotspots, we need to know what the penetrance of infection is there. So we need to put a light on those dark spots that we don't know. We have to act policy-wise on data, and we're going to be getting more data, a lot more data." March 25th, death toll 1,260. Trump blames media for social distancing, suggesting once again a conspiracy to lower his approval rating. He tweets, "The lamestream media is the dominant force in trying to get me to keep our country closed as long as possible in the hope that it would be detrimental to my election success. The real people want to get back to work ASAP. We will be stronger than ever before." At this point, G7 nations are unable to agree to a joint statement on COVID-19 after Mike Pompeo and the State Department insist on calling it the Wuhan virus. Something that could be so simple like this, they're handling and it's affecting our international relations in ways that we probably won't know till years down the road. This time also the Senate passes $2.2 trillion bailout package. March 26th, death toll 1,614. 3.3 million Americans at this point filed unemployment claims. 160 million Americans under lockdown. This is 1 month to the day after Trump predicted the U.S. would be down close to 0 cases. U.S. passed China, become the world leader in COVID-19 cases, more than 80,000 positive tests. Trump touts testing. He's quoted saying, "It's a tribute to the testing. We're testing tremendous numbers of people." He insists of the pandemic, quoted, "This was something that nobody ever thought could happen to this country." Not true. Trump tells Hannity, "I don't believe you need 40 or 30,000 ventilators," based off of no medical advice or input, which is very dangerous. You can't be handling these issues by your gut. Once again, this affects so many different areas of our national security that it's insane. March 27th, death toll 2,110. Trump signs that $2.2 trillion rescue package. Trump once again on the infighting. On Democratic governors, this is him on Democratic governors he's feuded with in Washington State and Michigan. "I want them to be appreciative," he told Pence. "Don't call the woman in Michigan. If they don't treat you right, I don't call." At a time like this, like, can you imagine Winston Churchill when London was being bombed? "Hey, they're not treating me nice, so let's not help them out. Let's just wait until they're nice, and then we can go rescue them and go give them the support they need." Because that's what he's saying. Trump said he is a wartime president. So, all right, March 29th, death toll 3,251. Trump touts his TV ratings. His focus is not where it needs to be. This is it. This is crazy, making the country more divisive. His tweet literally is, "Because the ratings of my news conferences, etc. are so high, Bachelor finale, Monday Night Football type numbers, according to the New York Times, the lamestream media is going crazy. Trump is reaching too many people. We must stop him," said one lunatic. See you at 5 p.m. Trump then extended the social distancing to the end of April, and he claims he just heard for the first time that 2.2 million Americans could die without social distancing. Also, another conspiracy theory that Trump suggested was that the nurses are stealing respirator masks. He is quoted saying, "Something's going on. Where are the masks going? Are they going out the back door?" I mean, the balls to accuse people who are on the front line, under-equipped, getting worked to the bone, to accuse them of something like this that is... March 30th, death toll 4,066. Trump touts completion of 1 million tests, 26 days after Pence insisted that those were already distributed. Coronavirus response coordinator Dr. Deborah Birx warns of mass death. If we do things together well, almost perfectly, we can get in the range of 100,000 to 200,000 fatalities. March 31st, death toll at 5,151. Trump, this is him saying, the surge is coming and it's coming strong. We are going to go through a very tough 2 weeks. This is going to be a very, very painful 2 weeks. He then went on to blame Obama for obsolete tests, which is impossible considering the virus wasn't discovered until after. So you can't really provide a test for a virus that didn't exist until after. Anywho, that's Trump. But then he was asked whether impeachment took his eye off the ball. Trump responds, I guess it probably did. If that took his eye off the ball for this, what else did it? This is taking away resources from where they need to be to focus on keeping tabs on our national security. Like this, April 1st, death toll 6,394. Trump touts his social media clout. Says, did you know I was number one on Facebook? I just found out I'm number one on Facebook. April 2nd, death toll at 7,576. An additional 6.6 million jobless claims. Jared Kushner claims that the nation's medical stockpile is not for the states. He's quoted saying, the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be the state stockpile that they then use. Who's it for then? So that just shows that the disconnect and the utter train wreck that was going on within the response towards this. On the same day, Fauci releases a statement on the lack of stay-at-home orders nationwide. He's quoted saying, I don't understand why that's not happening. April 3rd, death toll 8,839. The CDC advises cloth mask for the public. Trump says he won't. He's quoted saying, I just don't want to wear one. He touts the response to the pandemic. He is quoted saying, we have done a job like nobody's ever done a job. Many of the states were totally unprepared for this. They should add more ventilators. Once again, like, people follow what he says. Why they do, I don't know. I mean, I know he's the president, but him particularly, I don't get it. But people do. Sadly, people do. So him not wearing a mask, even if it causes one person not wear a mask that has the virus, will spread it. Continue to spread. April 6th, death toll 13,398. Larry Kudlow was quoted saying, I don't believe anybody could have predicted the exponential rise of this. It's just totally incorrect because they definitely did. And this is his administration. April 8th, death toll 17,691. Trump administration announces it will end FEMA funding for coronavirus testing sites, claiming it's on the states to pick up the tab. Naturally, there was a very large outcry, and so the government reversed the decision. April 9th, death toll 19,802. Trump decides to release or to put out a tweet. He says the Wall Street Journal always forgets to mention the ratings for the White House press briefings are through the roof. In parentheses, Monday Night Football, Bachelor finale, according to New York Times. And his only way for me to escape fake news and get my views across. Wall Street Journal is fake news. April 12th, death toll 25,789. Fauci on CNN. If you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. So, coincidentally enough, Columbia University released a study. It showed if the lockdown went into effect 1 week earlier, 36,000 American lives would have been saved. If it went into effect 2 weeks earlier, 54,000 American lives would have been saved. April 13th, death toll 27,515. Trump insists at a White House press conference, everything we did was right. When you're skirting responsibility, when you're not taking ownership of a problem and being accountable, it affects the entire process and handling and response which affects our national security. April 14th, the death toll is at 30,081. Trump delays the stimulus check to struggling Americans so that they can include his signature. They need this money. The economy needs this money. It is needed. And he delays it so he can put his signature on it. Trump also announced that the United States will freeze funding to the World Health Organizations, scapegoating the UN agency for severely mismanaging and covering up the spread of coronavirus. The implications that this has on international relations and our country are just a lot. April 17th, death toll, 37,448. Trump sides with protesters defying stay-at-home orders in blue states. He tweets, "Liberate Michigan." He did this for Virginia. This is just causing pandemonium in a time when it can't happen. It is just utterly unbelievable, unprecedented, and it's Trump. April 19th, death toll at 40,901. Trump predicts the final death toll for the coronavirus, quoted saying, "It looks like we'll be about 60,000 mark." April 20th, death toll 40,853. Amid the White House boasting of testing availability, Maryland's Republican governor scores 500,000 tests from South Korea in an end around of the Trump administration. He did this to prevent their confiscation by the federal government, because Larry Hogan would have put the stockpile of tests under watch of the National Guard. April 23rd, death toll, 50,234. So remember earlier, I said Trump tweeted that the press conferences are the only way for him to escape fake news and get his views across. So what was one of those views? Trump said that we should inject disinfectant to cure COVID-19, and we should even inject light. The president suggested that. And companies had to put out statements saying, don't do that, because people listen to him. Why? Once again, April 24th, death toll, 52,191. Trump signs finally the $484 billion relief package for hospitals and small businesses, which we all know was a train wreck, and a lot of the small businesses that needed them didn't get them. A lot of businesses went out of business because a lot of larger corporations took it. There was no oversight for the distribution of that money. April 27th, death toll, 56,795. COVID death totals rival those of American lives lost in Vietnam. So Trump bumps his death toll projection to 70,000, insisting, and I quote, "We've made a lot of good decisions." April 28th, death toll, 59,265. Trump returns to predicting virus will resolve on its own without a vaccine. He says, "I think what happens is it's going to go away." April 29th, death toll, 61,655. He repeats the vanishing virus claim. He's quoted, "It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated." April 30th, death toll, 63,859. Jobless claims hit 30 million. May 3rd, death toll, 68,697. Trump ups the death projection, is quoted saying, "Let's say it's 100,000, or 90, or 95. May 5th, death toll, 72,271. Trump dismisses concerns of rising deaths as state economies reopen, suggesting people will die either way. He's quoted saying, "We're letting people go to their jobs. They have to do it," he says. Goes on to say, between drug abuse, suicide, there's no great win one way or the other. Okay. May 6th, death toll, 74,799. Trump continues to highlight the negative PR effects of effective testing. he is quoted saying, "In a way, by doing all of this testing, we make ourselves look bad." Testing is critical to addressing this issue and getting it under control. So him openly admitting that getting more tests out there and having the numbers rise makes him look bad just shows what they're willing to do, or it makes you think like, okay, well, if they think that, what will they do with that? What are they trying to minimize it? And then that just puts more American lives at risk, and necessarily so. It's stuff you read about in other countries, third world countries, like with dictators, authoritarian governments. Like, it's not real. It can't be here. It is. May 7th, death toll 76,928. After 20,000 nursing home deaths, my grandfather being one of them, the administration finally delivers its first PPE shipment to a nursing home. I know this has been long. I appreciate your patience, but I just had to go through on how terribly they botched this and how it's going to impact our national security, not only for the next few years, but possibly generations to come. Thank you.